probably don't even use much salt." He says, "No, I don't." I said, "I don't know if this is going to help you with your cancer, but I can tell you this. Within a few days, you're going to have a heck of a lot more energy." Well, which is what happened. But this went on for 4 months, and in 4 months, Drew Bauman from Old Forge, formerly from Old Forge in Scranton, he was 100% free of cancer. Wow, what in the world is this? His whole life changed. But this wasn't isolated to him. It was one after another, like Bob Van Leuvening, who had MS for 7 years.
Right, and I'm sure there are a lot. I'm sure there are a lot of different people, Bob. And I know again that you've talked to a lot of these people, but along with the fact that you drink X amount of glasses of water a day, and you eliminate caffeine and alcohol, you also add some salt to your
quarter
diet.
teaspoon for every quart of water you drink.
But isn't it also just common sense that if I stop smoking, if I smoked and if I drank, if I stopped doing both of those things, eventually I would start to feel better anyway? I mean, that would seem to be common sense also.
There's a common connection with smoking and dehydration. For instance, we've seen people who drink a lot of water, they get detoxified. So the harm from tobacco is literally minimal. But if you're dehydrated and you're smoking, now you're doing major damage. But the water and the salt are the most critical thing. Well, for instance, pretty much anybody in science knows that the foundation for life is oxygen, water, and salt. So therefore, if nothing can kill you quicker than lack of water, other than lack of oxygen, common sense would say, better check your water level before you get carried away.
Well, we hope to find out from some of you out there how successful you've been, or perhaps how it has not worked for you, as you give us a call at 1-800-326-9842. Dr. Brown, I'll come back to you, and I'll ask you the same question I just asked Bob. If I smoked and I drank every day, and I quit both of those habits, wouldn't I naturally start to feel better anyway?
Yeah, you would. And I think I'm not really familiar with any of the specific cases, but again, I get back to the science of it, and I hate to hammer home on the science, but that's in fact what I do.
I'm delighted.
What?
I'm delighted because I'm going to floor you on the science.
Okay, well, then you can, but again, we've come to realize that a good part of how you feel and how you get better has a tremendous psychological component. And again, which is why you need to do placebo-controlled trials. Just intervening with someone can make them feel better sometimes. It doesn't cure tumors, but I'd have to see that case and look at all the details of it. It's not entirely clear to me. But to eliminate that, you need to give people in a blinded fashion, give them the intervention, and then give them a placebo and see whether it makes a difference, to get rid of this overlay of, well, somebody cares about me and I'm doing something and I feel better, because there's a tremendous amount of that. That's what happens. That's why you need to do what? You need
empathy.
You need to do controlled trials, and they need to be blinded, and you need to show that there's a statistically significant difference between the group that got the intervention and the group that got the placebo to say that the intervention did anything. Sometimes the intervention does bad things, and it actually works the other way.
Dr. Brown, are you aware that when they did a double-blind trial on these depressant drugs, antidepressants, sugar worked much better, but the result was doctored to come out that the drug was working. This was out in the news. Sugar pill infinitely more effective, whereas the antidepressants worked 37%, the sugar pill worked at 43%. So this double-blind trial doesn't necessarily work. It depends who is engineering the results.
Well, it worked, and I don't know what happened to the results of that trial, because I did not see it. But
yeah, but every time something is said, you say that you haven't seen it. The information on dehydration or water cure of peptic ulcer disease has been published in the Journal of Clinical Gastroenterology in '83. New York Times picked it up and syndicated it all across America, that water cured peptic ulcer disease. This is the editorial of the journal. This is a mainstream journal.
But this wouldn't be the first case for both of you doctors. Would not certainly be the first case where the medical community in doing research has shifted its thinking, at one point believing that A was the right thing to do, and later finding that in fact B was the right thing to do. And I look at something that a lot of people are very, very familiar with right now, and that is the Atkins diet, where, you know, back in the 70s, it was, you know, when it first came out, the thought and the rage that, you know, the high-fat intake would actually help you lose weight. And now studies are starting to come out that suggest that that's, you know, that's not necessarily the case. So aren't we really seeing something played out here that has happened in other studies also?
The role of water was not known, but the effect of it was known throughout history. But no one studied the science of physiology of dehydration. That's what I've done for the past 20 years. When I discovered that water cures pain, I became curious. And then I discovered that pain is a signal of dehydration in the human body.
Now,
So
what about the salt aspect, though, Doctor?
there are two oceans of water in the body. There is one ocean of water inside the cells of the body, then there is an ocean of water outside of the cells of the body. The water that we drink goes and joins the ocean inside the cells. We need some salt to retain some of that water in the environment around the cells. These two oceans have to be in balance. You cannot fill up the Atlantic and let the Pacific dry up. That is the reason why you need salt, in order to balance the two oceans of water. Salt has many other functions. Salt is the extractor of acidity from the interior of the cell. So when acid builds up in the cell, sodium goes in, hydrogen ion comes out. So it's a balancing factor. That's why you also need salt, in order to use it as a pain killer, so-called,
Right.
because it's the acidity that gives you the pain.
We are ready to take our first caller of the evening, and it is Geraldine, who is with us in Exeter. Geraldine, welcome to the program.
Well, I was wondering, since I have high blood pressure, what effect salt would have on my blood pressure, since you're not supposed to have salt when you have high blood pressure. So the salt in the water, what effect would it have?
All right, we're going to let both doctors answer that question, and we'll start with Dr. Brown.
Well, theoretically, individuals with hypertension should restrict their salt. A lot of the medications that you take to control hypertension are designed to eliminate salt, and salt has an aggravating effect on hypertension, and that's one of the tenets that are held in clinical medicine. Now, I think that Dr. B has some other thoughts about that, but that's been fairly well established, and therefore I would not recommend salt intake to any extent in a person who's being treated for hypertension.
Now, Dr. Batman-Gelich, that's, you know, my common sense thinking would tell me the same thing, but I'm curious as to what
But when the body is retaining salt, it's expanding the volume of water outside of the cells, and from this water it takes and filters and injects water into the cells. So that is why there is a drive for retaining salt. Medical community goes and says, no, you don't understand the system of hypertension, you must get rid of the salts. In other words, they shrink the water volume outside the cell, and so the blood pressure goes up and up and up, and then they have to give secondary medications, beta blockers, calcium channel blockers, and so on. Wrong, because salt is actually good for hypertension, but you need the intracellular elements as well, such as calcium, such as magnesium, and such as potassium. If you give these three other elements to the body, salt actually will bring the blood pressure down. It's a recent research published as late back as 2 or 3 years ago.
Okay. Could I add to that?
Absolutely, Bob, before we go on.
I was just talking to
call.
Dr. Lang Su from Peckville. He's on staff at Mid-Valley Hospital. And, of course, you know, he may call in. He's had tremendous results with salt. Now, he himself has had high blood pressure for years. And he read the article in Whitaker's Health and Healing. He investigated himself, and now all of his high blood pressure patients, I should say a lot of them, he treats with the WaterCure and getting fantastic results.
Okay, now you said a lot of them, but not all of them.
Well, I don't know. I don't know if it's all of them.
Okay.
I know I see it all the time.
Okay.
People telling me, coming in, geez, my high blood pressure's gone. But I can also say some of the people said no. But the majority of them do very well. Now, some of them will suggest they cut back on the salt, because we have Dr. Batman-Gelich's books, and he advises, hey,
Sure.
you've got a problem, work through your doctor. He always says, work through your doctor.
All right.